And a section of Rochester's Commission on Racial and Structural Equity, or RACE, hosted a Zoom Community Voices session tonight. The group says they're looking to understand why barriers remain in place to so many who need psychological care, particularly those within communities of color. Christian Garzone listened in on the meeting this evening. He joins us now live from downtown Rochester with more. Christian.
Well, Adam, many of the discussion points tonight stem right from the death of Daniel Prude back in March. The group talked about responding to mental health arrests in the future, but also they wanted to get to the core of how to best treat mental illness and substance abuse. The Mental Health and Addiction Work Group of the RACE Commission is seeking to capture personal stories and understand why barriers stand to so many who need psychological care. Young Haley Dennis, who has bipolar disorder, telling the team if mental health officials could have responded to Daniel Prude's arrest, a man in crisis, the outcome could have been different.
I think that medical professionals should be present for mental health arrests, not just policemen.
Another young person says since 2015, 23% of those who died in police custody here had a known mental illness.
I think it's time to look at the fundamentally flawed basis of how the city treats people living with mental illness.
For solutions, Melanie Funches says we need to begin responses that are cultural, to know what it's like to walk in someone else's skin. She says the people who can help are right here in our community.
There needs to be a different way of looking at indigenous and culturally specific interventions.
Dr. E.J. Santos says education and diversity with help and leadership are key. Mental health, she says, currently a stigma. She says not many want to admit they have psychological or substance abuse problems.
Mental health is health like physical health. I just want everybody to remember that. If we are going to change something, we need to show as a community that we value mental health.
Other speakers highlighting the drug abuse rates now climbing across the region and the need for funds to combat these problems. For the next session, speakers want to bring in the perspective of the city's poor and hear their solutions. Now up next, the RACE Health and Social Services Work Group will host a community Zoom session on October 14th. In downtown Rochester, Christian Garzone, News 8. Adam, back to you.
All right, Christian, thank you. Now, that commission, RACE, was established to identify structural racism and inequities in Rochester and Monroe County.